Okay, thank you everyone, media, for joining us. We've got media on the line with us today for our bi-weekly briefing with Premier Cochrane, Minister Green, and Dr. Kandola. We're going to get started right away this morning by letting Premier Cochrane provide some opening remarks.
Thank you, Krista. Good morning, everyone, and thank you for tuning in today for our last regular COVID-19 update for 2020. With me here today are Health and Social Services Minister Julie Green and Chief Public Health Officer for the Northwest Territories, Dr. Kandola. The COVID-19 pandemic has had a significant impact on our lives. In the last 9 months, we've been able to keep the number of cases in our territory low, due not only to the pandemic response effort led by our dedicated public service, but by all residents of the Northwest Territories. However, the holiday season is upon us, and as we have done for the past 9 months, we need to continue to follow our public health orders. I understand and I emphasize with what we are asking you. Being apart from friends and loved ones at this time of the year is hard, and the sacrifices we're all making are for the greater good of the Northwest Territories and our communities. This can be a difficult time for people, and the increased pressure of the pandemic has put our mental health in jeopardy. It should not be ignored. Self-care is critically important to a healthy life. However, we often dismiss it as less deserving of our time and attention. Too many residents of the NWT are suffering in silence, left feeling anxious, isolated, and worried about the future. To anyone who suffers from mental health or substance abuse issues, I want to say this: you're not alone. We are in this together, and we are here for you. The government of the Northwest Territories has a number of programs and services available for residents to help them through the struggles that you may be facing, particularly in our smaller communities. Please visit the government's COVID-19 page at www.gov.nt.ca/COVID-19 for more information. Our success in limiting the number of COVID-19 cases in the Northwest Territories is because you have done your part by following the public health orders and self-isolating when required. And with a vaccine arriving in our territory in the coming months, you may begin to think it's okay to become relaxed about following the orders that are in place. However, I can't stress enough that this is not the time to let our guard down. As we've seen in southern Canada, it doesn't take long for the virus to travel and quickly put a significant strain on the healthcare system. The stories coming out of hospitals and long-term care facilities across Canada show us a system that is grappling with overtaxed staff and being pushed to the brink. When we don't follow the rules, we begin to put our health system at risk. We need to think about the people who make our healthcare system function: doctors, nurses, specialists, the staff who day in and day out take care of us when we need them the most. To our healthcare workers, thank you. Thank you for keeping our communities safe. In these challenging times, you have put the residents of the territories ahead of yourselves. We all have enormous gratitude for all you're doing. Your courage, dedication, strength, and selflessness have not gone unnoticed. I want to thank again all the residents who follow the CPH orders and recommendations. Your actions mattered, they still mattered, and they will continue to matter until we can get vaccinated. We have been able to keep our numbers down in the territories because we have been diligent about protecting residents and communities. Let's all keep up the good work. We're almost there. I want to wish everyone a happy holiday season, and please continue to wash your hands, wear a mask, keep your distance, enjoy your holidays, but keep safe. I now want to turn it over to Minister Green. Thank you, everyone.
Good morning, and thank you, Premier Cochrane. As we near the end of 2020, we're also closing the door on what has been an unprecedented and challenging year. I know many of us are eager to put the last several months behind us and to start fresh in 2021. I can tell you that we have much to look forward to. In the coming days, we expect the Moderna vaccine to be approved by Health Canada. This is exciting news that will move us one step closer to resuming the way we lived before this pandemic. In the meantime, staff will be on high alert over the holidays to reduce potential community transmission arising from travel in and out of the territory. They will be working tirelessly to develop a robust vaccine rollout plan that will reach each and every NWT community sooner rather than later. And I want to take this moment to thank all of the people in the Department of Health and Social Services, NTHSSA, Clecho Community Services Agency, and the Hay River Health and Social Services Authority for all of their efforts to keep us safe. There is a sequence to the crucial work going on behind the scenes to prepare NWT residents for immunization. We will be careful and methodical in our planning over the next few weeks. We know we likely won't receive the entire shipment of vaccines all at once, so we are still waiting to find out the exact number of doses and receive that first shipment. This information will allow us to narrow down exactly who from the prioritized groups of residents will be first in line. We are finalizing hiring and training our vaccine teams. They will work alongside local healthcare staff when the rollout begins. We're expecting portable freezers to arrive that will be used to transport the vaccine to communities. The first full-size specialized freezer will be used for primary storage and monitoring of the vaccine, and it is running smoothly in Yellowknife. The second freezer landed in Inuvik yesterday afternoon. We're reaching out to translators to ensure our communication about the vaccine is available in all NWT official languages. This is a request heard from Indigenous and community leaders during engagement last week. Much of this information is dependent on documents that will be released once Moderna is approved. We will be running a tabletop exercise with Joint Task Force North to run through the logistics of the immunization response plan. This will allow us to test our readiness to order, receive, distribute, and administer the vaccine to prioritized residents in the new year. This is a giant undertaking over the holidays, but I have every confidence that staff from all three authorities, the Department of Health and Social Services and our partners at Joint Task Force North. I look forward to sharing the NWT vaccination plan and more specific details of that strategy. I'm now going to talk about some of the supports available as many of you take some much-deserved time off to recharge and be with your loved ones this holiday season. It's been a long year for all of us. Some of us have had to learn to work from home. Many of us have never stopped working, and others still face the uncertainty of job or business losses. I want to acknowledge the sacrifices of NWT residents and thank you for all you've done to protect the NWT during this pandemic. I want residents to know that supports are available if you need them, especially over this holiday season. Community wellness workers are available. The NWT helpline is always open, and for all GNWT employees, the Employee and Family Assistance Program can be accessed 24/7. To close, I would like to wish everyone in the Northwest Territories a safe and happy holiday season. I look forward to seeing you in 2021. I will now pass remarks over to Chief Public Health Officer Dr. Kami Kandola to provide a COVID-19 update. Thank you.
Thank you, Minister. I want to spend some time in each of these updates giving what comfort I can around the process required to ensure vaccines are safe. We know that vaccines work. Cases of whooping cough, measles, and polio have been squashed by more than 87% across Canada since effective vaccines were developed. Moderna has completed 3 phases of clinical trials with their vaccine, and they have been granted emergency use authorization by the U.S. Food and Drug Administration. There were 30,000 participants in the third clinical trial phase alone. We are likely days away from Health Canada approval. This regulatory oversight is required before any vaccine or drug reaches the Canadian market and before it ever reaches an arm in the Northwest Territories. The reason why Moderna has moved so quickly is because across the globe, there has been united focus on beating COVID-19. This came with unprecedented attention and investment, which allowed the 3 stages of trials to be run in a much shorter time frame. Reducing administrational requirements and keeping the country's primary focus on one priority helped shorten time frames significantly. This is done without compromising on the scientific processes needed to ensure the vaccines are safe. I am confident in the rigorous scientific process and the depth of expertise at Health Canada and other regulatory agencies. And all Northerners should share this confidence as we look towards light at the end of this tunnel. We also must not lose sight that the fight against COVID-19 is far from over. There are over 6,600 cases per day reported in the past week across Canada, with an average daily count of 114 deaths. This will not end as soon as the vaccine is made available, and will take time before we start to see numbers go down. As thousands across our territory get ready to celebrate the holidays, I cannot stress enough the importance of limiting the size of your gatherings. We are already beginning to see surges in cases of COVID-19 in Canada that are linked to household get-togethers as families and friends begin to connect for the holiday season. As a result, many provinces have effectively canceled the holidays. We are fortunate to be in a position to celebrate after a long year. And it is because everyone in the territory worked together and made real sacrifices to get control of the virus early and ease restrictions gradually. It is tempting to feel like the Northwest Territories is in a bubble because of the successes so far, but we are not. It only takes just one mistake to cause an outbreak, and that outbreak can be hard to manage, and we cannot afford to lose the ground we've already gained. That's why we have layers of protection in the Northwest Territories. Like any choice you make about your safety, it is very rare for a single measure to keep you safe. In a car, you wear your seatbelt, you drive the speed limit, and make sure your children are safely in their booster seats. For COVID-19, we do require self-isolation after travel outside the territory, not only for the traveler, but for the entire household. We also require that everyone follow routine public health measures, such as physical distancing, wearing non-medical masks in public spaces, regular hand hygiene, respiratory practices, such as staying home when you are sick, and also limiting gatherings and following other healthy habits. Self-isolation can prevent cases from becoming outbreaks. Public health measures like limiting gatherings size prevent further transmission once COVID-19 is out in the community. And even if you have not traveled, following all other public health measures help reduce the spread if one of those other protections fail. We will see more COVID-19 in our territory. What happens next is up to us. So here are some good ways to do your part to keep our territory safe. Stick to the gathering limit of up to 5 people, not already living with you. And have no more than 10 people in your home at any one time. Set boundaries for your gathering. Remind everyone if they're self-isolating, they should not be attending. If there are folks who couldn't come because they were self-isolating, involve them over Zoom or by phone And consider dropping off a doggy back on their doorstep so they feel included. Most importantly, if you're feeling sick at all, don't host or attend any get-togethers. Set that expectation for anyone who is supposed to come to your get-togethers as well. Now is not the time to tough it out, because that could make things a lot harder for your parents, your grandparents, or those you know who are at higher risk if it winds up being COVID-19. Which brings me to my final point today. If you feel sick at all, even if it's just a sniffle, it has never been more important that you stay home and call your public health center or public health unit to get tested for COVID-19. We have testing capacity in every community across the territory so that you can get your results faster, usually within 2 days, no matter where you are. Getting tested is how you can get some peace of mind while you're feeling sick. And it's how public health professionals can keep communities safer by tracking down contacts, possible exposure locations, and get others isolated to break the chain of infection. We need to be mindful that a negative test doesn't always mean that you will not develop COVID-19. So if you are isolating, you will need to stay home for the full 14-day self-isolation period, even if you get a negative test, just to be sure that you don't develop COVID-19 after your test. So please, at the first sign of sickness, call your local health center or public health unit and ask to get tested for COVID-19. Follow all the advice that is given to you. It could save a life. That life could be yours. Thank you, everyone. And please do your part to celebrate safely over this holiday season while we do our part to keep you safe.
Thank you, Dr. Kandola. So we're going to open up the floor to questions from the media. As usual, media will limit your questions to one question and one follow-up. CBC is also streaming our news conference this morning, so we will be watching there to see if any residents from home have questions. We'll try and do our best to get those answered for you before the holidays. So we'll start this morning with a question from Bailey, True North FM. And go ahead, Bailey.
Can you hear me? Can you hear me?
I can hear you. Go ahead.
Thank you for your time, everyone. I was wondering, Dr. Kandola, if you can go into more details about the logistics, about the portable fridges that are being sent to the territory and how those will be used and where they're being sent.
That have already arrived, or one's arrived in Yellowknife and one's been in Inuvik?
Was that for me? I didn't.
Yeah, so that's, I think that's what you're referencing. So we can let Dr. Kandola talk on that briefly, and then we'll let Minister Green touch on that as well.
The 2 freezers have arrived. One is established at Stanton, and they're testing the cold chain requirements. And the other freezer has arrived in Inuvik, and that also is going through cold chain monitoring. And so they're both set up and ready to receive shipments.
Mr. Green, did you have anything additional to add?
I think that there's another round of freezers that are used to take the vaccine from these specialized freezers that Dr. Kandola was talking about to individual communities for use. So I'm not sure that those are here yet, but we're getting everything in place to distribute the vaccine. Thank you.
Do you have a follow-up question, Bailey?
Yeah, I was more asking about the second group of freezers that Minister Green was talking about. I don't know if you have any details about which communities those are going to be sent to, or are they going to be stationed at airports so vaccines can be flown out? How is that going to work? Yeah.
Minister Green will give it to you.
Yeah, thank you for the question. So we do not yet have a list of times and places the vaccine will be delivered. It's my understanding that the portable freezers are the way to move the vaccine from the pharmacy in Stanton or the one in Inuvik to the community where the vaccine is going to be delivered. So we are awaiting the arrival of those portable freezers, and the vaccine distribution plan will be made available at the beginning of January. Thank you.
Thank you, Minister Green. We'll now turn to Cabin Radio. Megan, did you have some questions?
Just I did. Thank you guys so much for having us today. I guess I wanted to ask, probably to Dr. Kandola, how much of a surge in the virus are you expecting in the NWT post-holiday season?
That is a good question. I'll just give you a quick status update. What we have so far, we've conducted 9,335 tests, and we've had 24 clinically confirmed cases, of which only 3 are active. What we are seeing is this week and next week, there are a lot of friends and family who are visiting their relatives in the Northwest Territories over the Christmas period. So we have a surge in visitors in that category. We also have a surge in visitors in terms of the essential workers who will be covering the holiday period as regular workers go on their break. So there is an increase anticipated this week and next week. The biggest increase I noticed just from looking at the number of exemption requests is the week of January 3rd. There's a significant number of travelers who are returning from travel down south into NWT, so those will be our regular NWT residents. As well, we also have a number of essential workers traveling in that week as well. So between now and mid-January are the highest traffic number of travelers coming in, and that also covers the full 4-week self-isolation period. So we are on heightened vigilance, which is the emphasis of basically travelers need to self-isolate for the 14 days. They're isolating with a household. The entire household needs to isolate for 14 days. And if they have any signs and symptoms, they need to be calling the health care center and getting tested. And we are also proactively reaching out for a symptom inquiry that for this holiday period. So we are in heightened vigilance. We have the testing capacity arranged so that anyone who needs a test can get it. The exact numbers, what we know is that there's about 6,600 cases occurring daily across Canada, so we know the importation risk is high. What we hope is that these cases will be contained only to the traveler or at worst the household if people follow through on the self-isolation principles.
Thanks, Dr. Kandola. Megan, did you have a follow-up question for that?
I did. Slightly different topic. Back to the freezers. I know you said you guys you have freezers that you can use to ship the vaccine to different communities. But I know that last week Moderna came out saying that the vaccine doesn't actually need to be freezed when shipped locally. Does that change things on your end logistically in terms of the rollout plan?
So I think we'll let Minister Green answer this, and maybe Minister Green, you can touch just a little bit on the Rollup approach and when media and residents can expect to hear on that.
Thanks for the question. So the idea with the portable freezers is, I think, to ensure that the vaccine arrives where it's going in good condition, even though it needs to be thawed before use. These are very precious doses of vaccine that we're going to treat very, very well, so that they arrive in good condition in the communities they're destined for. The first week of January, we'll be unveiling a whole of government vaccine distribution plan. It will include information such as the prioritization of who gets vaccinated, and approximately when and in which communities. There'll also be information in the vaccine plan about vaccines in Yellowknife, of course, and in the hub communities, how Joint Task Force North is helping us, all of the logistic pieces. Right now, we're in the midst of hiring, doing communications planning, and working out logistics. We are expecting the tabletop exercise early in the new year to test our readiness. So we're trying to put everything in place so that it's a very smooth and efficient rollout. Thank you.
Thank you, Minister Green. We have some written questions here from Richard at CBC. The first one, Dr. Kandola, you tweeted about the COVID Alert app. How many people have downloaded it in the NWT, and has it been used to trace any contacts yet?
So with that COVID Alert app, I have to go get back statistics on that. I know there was a minimum of 1,000 that had downloaded it, but there would be more, and we just have to get up-to-date stats. We had used it we've been fortunate with our contacts, the cases, they have had very limited contacts outside of their household. And so we were able to use the old-fashioned contact tracing method and be able to isolate the contacts of cases we've had. But if we were in a scenario where there was a location where we had to do exposure notification and we didn't have that defined list of contacts, we would provide that case with a special key that they could alert any of the contacts in NWT. But we only have 3 active cases, and we've been able to manage because people followed the rules. They're isolating when they get home, they're isolating with their households, and they're really, literally minimal contacts outside of the household, other than the scenario where we had plane from Yellowknife to Edmonton, Edmonton to Hay River. We had another scenario of a case that had been a plane within the infectious period, but those, we had a flight manifest, and we were able to contact those contacts as well.
Second question here from Richard says, Dr. Kandola, last week in the briefing you did with media, you listed the people who were going to get the first wave of vaccines, including elders. He'd like to know, how is the government defining elder? Are we saying 60 and over? If so, there's 6,500 people in the territory who are 60 and older.
That's an excellent question. So with the priority groups, we would be looking at elders, those with high-risk conditions, essential frontline workers, and Indigenous and remote communities. So those are the 4 categories. But within those categories, elders alone are over 6,000 people. So we would define high-risk elders in that category. So anyone in the long-term care would be a priority in the first rollout. The first shipment is people in long-term care, healthcare workers providing support to them, elders in remote Indigenous communities. So when we start to define elders, even higher risk elders with high risk conditions, it's not all 6,000 that would be immunized right away. It will be a subsection of that.
Thank you. All right, we'll go back to the line here. We'll turn now to Paul, Hay River Hub.
Thanks. Can you hear me okay? Can you hear me?
Yeah, go ahead.
Okay, thank you. This is a question for Dr. Kandola. Dr. Kandola, you've been advising now for, I guess, weeks at least against people traveling in and out of the territories over Christmas. I'm wondering, are you seeing any impact from that that advice? Are you seeing a decrease in numbers, or are you able to determine how effective those warnings have been?
So that's an interesting question. We've the travel restrictions came into force on March 21st, and that significantly decreased travel from the get-go of people being able to travel in. The recommendation has always been to avoid non-essential travel out. This has been a unique year. If I could, if we were to look at the number of travels coming in December and January compared to last year, when we didn't have travel restrictions, you're going to see a significant reduction. But because it's comparing apples and oranges, it's the only way we would be able to know of all the travelers coming, all the people traveled down, came back in, they would have to self-disclose if this was essential or non-essential. And so we don't have that level of detail. But what I do know is there are many residents who made decisions not to travel out for the holidays, and there are a number of students and a number of relatives who made the decision not to travel in to the territories. And that kind of analysis will be best captured with a survey that we could do later on to say, did this impact your decision? But currently, I can't provide you that data.
Second question, Paul?
No, that's it. Thank you.
Okay, thanks. Written question here for Premier Cochrane. Premier Cochrane, can you tell residents whether or not they can expect enforcement to be in full effect over the holidays or not?
Thank you. Yes, I think that everyone is aware that the holidays is a time for gathering and a time that actually puts us at more risk for community spread. Like Dr. Kandola said, if people are abiding by the orders, leaving or coming into the territories and self-isolating, either alone or with their whole family, then those are contained and doing well. However, we do have people that don't always abide by the orders, and because this is the critical period, our enforcement team will be working right through the Christmas season. So I've really emphasized to everyone, we don't want to give you a ticket, but we will if we have to. This is the critical time, so please abide by the orders and the recommendations, and may everyone have a happy Christmas, including the enforcement team. Thank you.
Thank you, Premier. Okay, we'll turn now back to our line. Blair, NNSL.
Yes, can you hear me?
Yes, we can hear you.
So yeah, going off the question about enforcement, will enforcement be increased beyond its current level? For example, with people celebrating in bars over the holidays, especially over New Year's Eve, will there be additional measures to make sure that there aren't too many people gathering in the bars?
So we'll give that one to Premier Cochrane.
Well, we've done spot checks in the restaurants and bars recently. We will continue to do that. At this point, we're full staffed with the enforcement team, but if necessary, if there are people that, if there's a huge surge, then of course we would redeploy people from the JNWT to take up those positions. But again, my hope is that all residents would abide by the orders and we don't have to give one ticket out. It's not the Christmas present I want to give people, so I'm hoping that all residents will give the gift of safety to their neighbors, to their loved ones. If everyone abides, we won't have to give any tickets out. Thank you.
Second question, Blair.
Yes. Are COVID complaints still being accepted by the Protect NWT line?
Premier Cochrane.
Thank you. Yes, absolutely. We need people to follow the orders, but we also know that not everyone does follow the orders. Some people don't even believe COVID-19 is in existence. For those ones, we also need residents to help us. We don't have enough enforcement officers to have one person on every single person. So if you see people in your communities that you think are abiding by the orders or not, please, right through the holidays, phone the 811 number or the Protect NWT. We won't get back to you. I know that a lot of people are phoning in saying we make complaints and nobody follows up. That's not true. Every single complaint that is made through Protect NWT or 811 is followed up. However, due to privacy, we won't call the people. But we need your help in this. We're all in this battle together. Thank you.
Thank you. Another written question here from Mario at CBC. This one to Dr. Kandola. Can you provide some more details about the dry run or delivery exercise of the vaccine that was done recently from a Yellowknife to a Nuvik? It was something that was mentioned in the Yukon this morning. Is that something you can touch on, or Minister Green?
I don't have any information on that.
Okay, so Mario will get you some information on that question. And then a separate question for Minister Green. You mentioned hiring and training in your remarks this morning of health professionals to administer the vaccine. How many people are you hoping to hire? What are we missing? Isn't that pretty late for hiring?
Sorry, what's the last part?
Is this sort of late in the game to be hiring for vaccines, I guess is the question.
Well, I don't have an exact number of people that we're going to hire, but we're creating these teams that have healthcare professionals, administrative people, and logistics people who will travel together to administer the vaccine. A lot of this work will be done by the public health units in the hub communities and by the health centers, but there is a need to hire some additional people. So I know that the department has been looking for anyone who may be recently retired and still has an active license to sign up and be part of this work. So the idea here is to try and mimic what we do with the flu vaccine in terms of logistics, of having a place set up where people can go, and you know, the speed of the vaccinations goes very quickly. So that's the situation, and I can find out and provide additional information on the vaccine delivery dry run.
Thank you. And final question for us this afternoon for Premier Cochrane. Premier, can you give us a suggested message if friends and family are trying to get together in big gatherings, something that we can all say to our friends and family over the holidays?
A suggested messaging, again, like Dr. Kandola said, you are allowed 5 people into your home. Keep your bubble small. But those that can't, I come from a large family too. There's 10 of us actually, just in my own immediate family, never mind grandchildren and children and stuff. The message to be carried is that we love you, that everyone loves each other, and a point of showing the love. Christmas season is about showing love. And the best way we can show our love is to pick up the telephone or go on to Zoom. I'll be doing that with my mother as well this year. So keep connected with those you love, especially those that are elderly, that may be isolated in this season, but do it safely, either through the telephone or through Zoom calls. Thank you.
Thank you, Premier. And just one final message. I'm seeing messages here on CBC's live stream that they've got going to the Premier and our health leaders. So thank you to you as well, and happy holidays. And happy holidays to all the residents watching and media. Thanks for tuning in. We will restream this for anyone interested in getting follow-up questions. And if you need some more answers, you know to email presssecretary@gov.nt.ca. So we'll leave it for that, and happy holidays to all.